Health officials have urged Americans eligible for a booster shot to go ahead and get one now. This is a new Omicron strain. This is one of the fifth to surface since this winter is now taking hold.
There is no sign it's more virulent, but it is much more transmissible than earlier strains. The Fox Medical Team's Beth Galvin is here now with the latest. A lot of people have questions about this new strain, Beth.
Yes, Courtney and Tommy, and a lot of people trying to figure out right now how they're going to time their booster shots, wondering if they need to go ahead and get boosted now with this highly transmissible variant or whether they should wait until the fall when we have a better booster. But health officials are encouraging people to get up to date on their shots now. The CDC projects the latest Omicron spin-off BA.5 is now driving about 65% of new U.S. infections. It's the most contagious strain of the virus so far in the pandemic, able to infect people who've been vaccinated and those previously infected with the virus. But CDC Director Dr. Rochelle Walensky says the vaccine continues to offer a good level of protection against severe COVID-19, hospitalization, and death.
So staying up to date on your COVID-19 vaccines provides the best protection against severe outcomes. Currently, many Americans are under-vaccinated, meaning they are not up to date on their COVID-19 vaccines.
And that's especially true for second booster shots, recommended for those 50 and older and those with higher risk health conditions who are at least 4 months out from their first booster. Of those 50 and older, only 28% have gotten a second booster, and of those 65 and older, only 34% have gotten a fourth dose, as many Americans weigh whether to get a fourth shot now or wait for an updated vaccine that could be available in October or November.
Very clear to me, if you've not gotten a booster, if you're over 50, if you've not gotten a shot in 2022, first of all, getting one now protects you for the rest of the summer into the fall. Second, does not preclude you from being able to get a bivalent vaccine in the fall. So that's why I think for me it's a very, very clear recommendation.
Dr. Anthony Fauci, who recently contracted COVID-19 despite being fully vaccinated and boosted, says boosters are needed because the protection that you get from being vaccinated or infected weakens over time.
So if you've been infected or vaccinated and your time comes for a boost, that's when you should go and get the boost. And I might say myself, having been someone who's been vaccinated and infected, when we get the next round of having vaccines available months later, I will be in line to get another boost after that.
With BA.5, health officials say it's more important than ever to test yourself for COVID-19 before large gatherings or visiting with somebody considered higher risk. And if you do get infected, you may be eligible for the antiviral pill Paxlovid, now widely available, which can lower the risk of hospitalization and death by as much as 90% if it started within the first 3 days of developing symptoms.
And if you test positive in the days and weeks ahead, please consult your healthcare provider about your eligibility for treatments. Or please visit covid.gov to find a test to treat location where you can get tested and treated all in one place. Treatments can save your life.
And Dr. Jha mentioned those test to treat locations, and those are basically clinics or pharmacies where you can get tested and get Paxlovid all on the same visit if you're eligible for it. And now pharmacists are able to prescribe Paxlovid, so that should make the process a little bit easier for people to get access to it. And Tom and Courtney, I had to do this. I had 2 family members come down, both qualified for Paxlovid. I was in and out of Walmart down in Stockbridge in about 5 minutes.
Wow, they got it to you that fast.
Yes, their doctors called it in. I was able to walk in, get it for them, and bring it to them that
But now
night.
you're saying the pharmacist can prescribe Paxlovid, so that's going to make it even easier and more accessible.
And important for people to know that it must be taken pretty early on in their
Yes, and when we're talking about a medication designed for people who are at higher risk of getting sicker from this virus.
Okay, good information.
Yeah.
Beth, thank you.
Thanks, Beth.